Hi everyone, my name is Jamie Webb. This presentation is used to describe the effects of nursing delivered tobacco cessation in adults 18 years and older. Tobacco kills more than 480,000 people each year, which is more than car accidents, illegal drugs, AIDS, alcohol, murders, and suicides combined. Tobacco costs the U.S. approximately $170 billion each year. Healthy People 2020, their goal is to reduce illness, disability, and death related to tobacco use. They provided strategies that will contribute to ending tobacco use. Those strategies include increasing the price, smoke-free policies, expanding cessation treatments in clinical settings, media campaigns, funding tobacco control programs, controlling access to tobacco products, and reducing tobacco advertisement and promotion directed at children. The Level 1 article used for my research was an article the review was conducted on randomized trials to determine smoking cessation interventions delivered by nurses, and the trial lasted for 6 months. The review was over clinical trials of 58 studies. There was over 20,000 participants that were recruited, from hospitalized patients to outpatient settings to general population. Nursing interventions are defined as the provision of advice, counseling, and/or strategies to help patients quit. Advice was defined as verbal instructions from the nurse to stop smoking, whether or not they provided information. Interventions were divided into two groups, which were low intensity and high intensity. Low intensity groups, the nurse counseling was provided was less than 10 minutes with one follow-up appointment. High intensity group was the nurse counseling lasted longer than 10 minutes. Education materials were provided, and the patient was set up with several follow-up appointments. The research study findings concluded that there is moderate quality evidence that smoking cessation delivered by nurses can lead to a moderate increase in the number of patients who quit. The Level 2 article that was used, the researchers conducted a randomized control trial to evaluate the uptake and effectiveness of tailored smoking cessation support provided primarily by the practice nurse. There were 3 interventional groups, which number 1 was quit with the practice nurse, 2 was quit line referral, 3 was usual care. The quit with the practice nurse, patients were educated on the 5 A's approach, and they were assisted in making a quit plan based on that approach. They received face-to-face or telephone counseling. The quit line referrals were made by the general practice. The quit line referral would call the patient and assess their needs and offer them services. And then usual care was patients were assessed on their willingness to quit, and they were offered assistance in accordance with the usual practice, which included advice, referral, but no provision was made to facilitate either. Study findings revealed that the 3 groups were similar at baseline. Patients who received partial or complete practice nurse support were more likely to report sustained absence. The study did highlight that results were shown to have no difference by group on attention to treat analysis, but patients who received more intense practice nurse interventions were more likely to quit. I listed the 5 A's approach model. The 5 A's are ask about tobacco use, advise the patient to stop, assess their willingness, assist in referral making with counseling, and then arranging for follow-up appointments. The quantitative research article that I used was a study designed to interview nurse counselors to explain their perspectives on smoking cessation counseling, as well as barriers nurse counselors are dealt with in smoking cessation programs. The study utilized a ground theory approach. This approach allowed the researchers to start from the ground up through analysis of the in-depth interview data. The study consisted of 16 nurses from 11 hospitals. The nurses used within the study had to meet certain criteria to become eligible for the study. It was mentioned within the review that hospitalization provides a great window for providing smoking cessation counseling. In the review, the nurses did state they were faced with several barriers, and those barriers are lack of support from hospital administration, insufficient time, lack of commitment from other healthcare providers. When doing a synthesis of the research articles, the authors provide new perspectives of how nurses can affect and influence patients to quit smoking. Increasing awareness of tobacco cessation and allowing nurses more time to provide education can improve the number of patients to quit smoking. It was noted within the review that ensuring follow-up appointments and resources can help improve chances of patients to obtain absence. Smoking education provided by nurses can lead to increased number of patients who quit. Nurses can improve patients' health by teaching them the importance of tobacco cessation. Nurses are faced with several barriers that were mentioned previously, and increasing support and awareness of tobacco cessation can allow better outcomes for patients and nurses. My PICO question was, in patients 18 and older, does nursing interventions such as advice, counseling, and or strategies help smokers quit smoking more effectively than no intervention over the course of 6 months? Interventions are provide awareness to all healthcare professionals, arrange education for nurses to ensure education taught is the same, such as the 5 A's approach, prepare a proposal for hospital administrators on the importance and cost-saving effects of starting tobacco cessation education, and ensuring that nurses have adequate time to provide the education. To implement this intervention into practice, I chose an acute hospital setting. Education will be needed to provide evidence-based guidelines to the nursing staff and express the importance of providing smoking cessation to the patients. The advanced practice nurse will need to assess the patient's ability to learn and determine the best practice in providing tobacco cessation. Once patient is ready for discharge, the advanced practice nurse should make sure that follow-up appointments and resources have been provided to the patient. The advanced practice nurse should reach out to the patient's primary care provider to ensure that they continue to follow up the patient's progress on quitting, as well as it would be beneficial for the patient to involve their family for support. So just to conclude, it is beneficial for nurses to provide smoking cessation education to patients in hospital settings. Yes, nurses do face several barriers in implementing the tobacco cessation education, such as not having enough time or not having support needed from other healthcare professionals and or administration. But it needs to be known that more research could be done or conducted on the benefits and the effects of providing patients with tobacco cessation education within the hospital setting, since it does provide a great opportunity for our patients. Thank you, and bye-bye.